All right, welcome back. This is part 2 of our video. Part 1, we did the IV insertion. Part 2, I'm going to show you how to remove the IV properly, okay? The IV catheter, all right? So first thing you're going to do is always check the order. You need to make sure you have a doctor's order to remove it, or unless the IV is compromised, infiltrated, or something like that, that it has to be removed, okay? So you're going to, as you do with all things, you're going to verify the patient, introduce yourself, and explain to the patient what you're going to be doing. Sanitize your hands and get your equipment ready and put on your gloves. So, now, when you're looking at the IV, you're assessing what's going on, how much tape there's going on, how much hair is on the person's arm, to see what you're going to be in for. But as always, make sure your patient is in a comfortable position. And just reassure them that everything is going to be okay. So I have my gauze and my tape here. So I'm going to get my gauze ready, because when I take it out, I'm going to be ready. I don't want any bleeding. My goal is always no bleeding. I have alcohol wipes here in case it is a little messy and I need to clean things up. So I'll have that ready as well. And a lot of times, because sometimes IVs bleed and there's dry blood and stuff, and I just like to clean up the area, okay? So here the IV is associated with, connected to IV tubing. So let's go ahead and remove that. So you make sure that the IV pump and everything is off. Make sure that it is clamped. And then you can go ahead and disconnect that. Please, when you remove IV tubing, you put a clean cap or hub on the end to keep that IV sanitary. All right. Next, we will finish and remove the tape. And an FYI, when we're removing tape, we want to be gentle. But if you do have a hairy person, you want to be quick as well. You don't want to torture the person, and you need to just go ahead and rip it off, but make sure that the skin is pulled taut when you do that. Okay, with the tegaderm, it's a little different. So with the tegaderm, you just kind of lift and you can pull it and it releases, which is kind of nice. So it doesn't really stick like the tape does.
That's a nice little trick to lift.
Yeah, and you just pull. So now that you have your catheter exposed, you can go ahead and pull your tegaderm off. Get your gauze and your tape ready. Go ahead and put that on top so that you can pull your catheter out and you apply your pressure. Now you want to examine your IV catheter and make sure that you have, it is complete. That it's not a tip broken off or anything like that. Because that'll be very dangerous for the patient. You're applying your pressure and you're taping it down. And then depending on the medication that the patient is on, for instance, if they're on anticoagulant or blood thinner, then you're going to want to apply pressure for a couple minutes if necessary, because you don't want to walk out and come back because they're bleeding out.
We don't want that.
Yep. The catheter will go into the sharps. And then as always, please clean up behind yourself. Because it is the patient's room and not your mess. Don't leave your mess in your patient's room.
Because we do not want any dirty nurses.
Absolutely.
No nasty nurses. No.
Okay. And there you have it. Thank you for joining us today. Be sure to click, and subscribe.
And comment.
But
we already know you're going to like this video, you're going to comment, and you're going to subscribe. We already know, because we the aunties with the most, with the best. As always, we love you. Good job. Keep up the great work. And let us know what you want to see next. Thank you.